What's the biggest complaint you get from people who come to see you based on their age?
So yeah, it definitely does depend on their age. When you're talking people who are in their, let's say, 20s and 30s, more 30s ish. I don't see a ton of patients in their 20s. I guess in their 20s, it's going to be a lot of people who come in for minor concerns, like they maybe want to touch a Botox, they may want a little bit of lip filler. Maybe they've got age spots that they want to improve. I do still do a lot of surgery. I operate a couple of days a week. I do a lot of breast implant, that type of thing. So that's more in the 20s. In the 30s, a lot of my patients that I see that are women in their 30s often come in for issues related to having kids. So we're talking tummy tucks are very, very popular at that age group because typically once they're done having children and they look down at their tummy, they're like, geez, I've got all this extra skin. It's been all stretched out. I've been working out and nothing seems to improve it. Then they'll come to see me for a tummy tuck. And then when you get into like the 40s, it's going to be still, once again, the tummy tucks, breast lifts, stuff like that. And then 50s, 60s, and 70s, now we're really focusing on facial procedures like eyelid lifts, face lifts, that type of thing. Men can be very different. Now, I don't do nose jobs anymore, but the most common plastic surgery for men are nose jobs. And so that really across, really when you're looking at 20s up to probably their 40s, that's going to be the most popular surgery. The other thing a lot of men have done would be a liposuction, oftentimes to like the love handles, the abdomen, and then gynecomastia, man boobs. That's not an unpopular operation. A lot of men um, who are embarrassed, of having more breast tissue than they would like, they'll undergo an operation like that. And then once you get into the older ages, then we are also looking at kind of facial rejuvenation, eyelid surgery, facelifts. Not as common facelifts in men because of the scarring, but that kind of gives you an overview. And pretty much throughout all of those, we're doing a lot of skincare, we're doing laser treatments, we're doing chemical peels, microneedling, and all these non-invasive and minimally invasive procedures to help people look and feel like they feel on the inside.
So let's go the reverse of this. What do you think would be the fastest way for someone to age their skin and look a lot older?
So the number one ager of the skin technically is going to be getting excess sun. Now, sun is a very complicated situation because sun also is very therapeutic. I live in Michigan. I know what it's like to go many, many months out of the year with very little sun and how that really impacts your mindset, how it can even impact your health. And so I'm a believer in the beneficial effects of the sun, but you need to do that in moderation because getting too much sun can be very, very damaging to the skin. So that would be number one. Number two, kind of activity that would age you the fastest would probably be smoking. Smoking cigarettes specifically. There are some interesting studies that do find that when you look at actually wound healing, that e-cigarettes or vaping is fairly similar. Its negative effects on healing as actual real cigarettes are. With marijuana, because it's not legal federally, we don't really have studies, not so much on marijuana smoking and how that can impact healing. But if you look at the studies and you show that cigarette smoking is really bad for your skin, it appears that vaping is a pretty similar amount of quote unquote badness, then you have to assume that marijuana smoking is probably going to be pretty close in that category as well. So I would put smoking as number two. At number three, I would put just general bad diet. So eating a lot of ultra processed foods, eating a lot of sugar filled foods, those types of things can really, really impact the health and the quality and the aging of your skin.
And what are some of the signs that people start to see when their skin is starting to like age for the long term and not just like the short term things that may happen if someone's like sick or something?
Yeah, so it's really interesting, Doug, because when you're in your 20s, you can almost do anything and you seem to bounce back. So you can go out to the bar, have a bunch of drinks, pass out late at night. You don't wash your face or anything or put any creams on before you go to bed. And you wake up and yeah, you may have a little bit of a hangover, but by noon you're feeling pretty good and you go on with your day and you look fine oftentimes. When you hit your 30s, you start finding that, geez, I'm not rebounding quite as well as I used to. And so really, I think when people are in their 20s, a lot of us do take for granted, I think, our youth and how our body bounces back after being really, not taken care of well. In our 30s, you start noticing that your body is not bouncing back as much as it used to. And then in the 40s is when you start seeing that aging process come out. And how you took care of yourself in your 20s and your 30s will then definitely show in your 40s, whether you like it or not. Some of the first signs of aging that we see when people are in their 40s is going to be fine lines and wrinkles. That you're going to start noticing a bit more. Things like crow's feet wrinkles, deepening of the nasolabial folds or the smile lines. And the other thing you start seeing is you start seeing more unwanted pigmentation, hyperpigmentation. And so I fully believe that a lot of the sun damage that we get in our 20s and even in our 30s shows up in a delayed fashion when you're in your 40s and 50s. And so people who say, geez, I'm in my 40s, I'm never in the sun. Why do I have all these spots that are showing up on my skin? I fully believe that that's a delayed appearance of damage that was done before. And so spots are another sign of it. And then the third thing that people notice is loosening of the skin. They notice that their skin's not as tight anymore, and it's starting to sag a little bit. The cheeks aren't quite as high as they used to be. And you can even notice some early jowling. And some of that also can be impacted by hereditary factors as well. So that's usually what we see. 20s, you tend to bounce back pretty quickly. So people kind of take that for granted. I encourage you, don't take it for granted. Take care of yourself. 30s, you start noticing your body is not quite doing what it used to. And then the 40s is when things, the wheels can essentially come off if you have not been taking care of yourself. And then once you hit your 50s, we're all aging, pretty much anybody who's in their mid 50s has got some loose skin in the neck area and stuff. If they don't, then there's a question of if they've had something done to try to get rid of it. And really that's when, you really want to try to maintain whatever you have. And there's a lot to that, a lot of that I put in my last book, Younger for Life.
And so what can somebody do if they're trying to reverse some of these symptoms? Like if somebody's listening to this and they wanted to get a head start and say, hey, like I've been beating up my skin for years and I'm starting to see some of these signs, what's the fastest way to begin to look younger?
So the first thing that I would encourage you to do is to get on a good skincare routine, and it doesn't have to be a ton of products. I think a couple of years ago we did talk about this on your podcast before, but I'm sure you've got a lot different listeners now and more listeners. So I'll just kind of summarize what that is. So getting on a good skincare regimen is super important. There's some very simple steps that everybody can take, and I call it a 2 minutes, 5 years younger skincare routine. It takes 2 minutes a day, and you can look upwards of 5 years younger in as little as 2 months afterwards. And what that is using a good cleanser for your skin in the morning. You want one that is going to be ideal for your skin type. So if you've got oily skin, then a foaming type cleanser is good. If you've got more sensitive or drier skin, then look for a more gentle or hydrating or milky type cleanser. After cleansing your skin in the morning, you want to apply a vitamin C serum. That's going to help protect your skin against free radicals and oxidation, other types of damage that can occur throughout the day. Also, vitamin C is super important for supporting collagen production. Then you follow that up with a sunscreen, especially if you're going to be out. If you do wear one, recommend at least SPF 30. That's all you have to do in the morning. Cleanse your skin, vitamin C serum, sunscreen if you're going to be out. In the evening, super important, got to cleanse your skin, get rid of the day's worth of dirt, grime, oil, pollution, all that type of stuff. And then what you want to do is apply ideally a retinoid. Retinoids are derivatives of vitamin A. If you pick one anti-aging cream to use, the retinoids are the way to go. And over-the-counter retinoids are called retinol. Retinol usually is pretty well tolerated amongst most people unless you have super sensitive skin. And that typically is considered the gold standard for anti-aging ingredients in creams. And that's all you have to do at night. You cleanse your skin, throw on a retinol moisturizer, and unless you've got really dry skin, you want to add a night cream, you don't really need to. And then the only other thing that is definitely important as a baseline type of skincare regimen is 1 or 2 times a week you want to exfoliate your skin. You can do that with a gentle scrub, or you can do that with an at-home light chemical peel. That's going to get rid of the upper layer of dead skin cells to smooth your skin out, as well as to cause it to turn over more quickly. That's going to keep your skin looking and feeling healthier. So this is 2 minutes, 5 years younger skincare routine. We do actually have a bundle at my younbeauty.com store as well for somebody who wants to kind of get it all in one. It's just 4 products is all you really need, and that will get you there.
Did I see an interview you did recently where there was something about talking about putting like butter on your face.
So not necessarily butter, but you're probably talking about beef tallow. So beef tallow is obviously a hot topic with our HHS secretary. He's a big fan of beef tallow, and there are restaurants now serving beef tallow as ways to fry up food. And I'll tell you, I was in Scottsdale not that long ago, and there was a restaurant there that I went to called the Ends, and they only cook in beef tallow, butter, and olive oil. And we had beef tallow fries, which were fantastic, but it's not necessarily a healthy food. That being said, some people are taking it to the next level, and they're not only liking eating beef tallow and cooking in it, but they're liking putting it on their skin. So you can go online and you can find beef tallow moisturizers. Usually they'll combine it with some honey, and there have been used by a lot of people to help soothe their skin and moisturize it. Beef tallow is not necessarily bad for the skin. There's some good, healthy components to it, and they mix it with a little bit of honey. I think one of the reasons why is honey is antibacterial. One of the things you worry about with beef tallow is bacteria, growing in it, and God forbid it going rancid. But it is, I think, a reasonable cream to use for your body. You just don't want to put it on your face because it is comedogenic.
Yeah, you see a lot of things out there about what to put on your skin, what not to put on your skin. I know we've talked about it on the show before. I know you've covered it extensively in your content. And I think it can be confusing because like there's a lot of talk right now about sunscreen. And yet you're the first thing I asked you was, or not the first thing, but the first thing you said when I said, "Hey, what's the fastest way to speed up the aging of your skin?" You're like being out in the sun too much. And sunscreen traditionally is a protector of that. So like how do you hedge against protecting yourself from the sun while also putting the right type of protection on your skin?
I think Doug, right now, unfortunately, we live in a very all or nothing society and a one side or another society where it's all, people focus so much on the extremes. And so, yeah, there are groups of people who they say, the sun is healthy for you. Go out in the sun, get as much sun as you want because it's healthy for you. And if you do get, let's say, a sunburn or you get a skin cancer, it's not because of the sun, it's because of the seed oils that you're eating. And then on the other side, there are people who are slathering sunscreen on themselves and then hanging out in the basement all day, not even in the sun, and they will not go out without having everything completely covered. And I believe that both of those groups are wrong. Really, there is data. There's a lot of data showing, first of all, that yes, getting too much sun will cause skin cancers. It is what it is. You can see the difference in somebody's face, their legs and their arms, and you compare that to their butt that does not get sun. You don't see skin cancer show up on somebody's pale butt that has like no spots on it. They show up on the sun damaged areas. It's just asinine that you could think that that doesn't happen. That being said, it's also asinine to think that going out in the morning, getting sun in your eyes, getting your circadian rhythms like in check and all that is bad for you. There are times where the sun is fairly low, where you can get good sunlight, you can stimulate your circadian rhythm so that they're on the right track. And there's also vitamin D that you can get from sun that we know is very healthy for us too. Not only and there's also the mental health benefits of it. So I think that like in most things in life, Doug, there's a lot of people who like to sit on the extremes, and unfortunately, social media will amplify those extreme points of view. But the reality of what's best for you lies somewhere in the middle, and where in the middle that is going to depend on yourself. Some people can tolerate more sun than others. If I was Irish and I grew up in Ireland and I had red hair, then I would not, expose myself to nearly as much sun as if I was African American. Your skin can tolerate sun better the more melanin that you have, and technically, the more melanin that you have, the more sun you need to get to actually create the vitamin D as well.
Yeah, I think we live in a time, like you said, it's like all or nothing. And I think a lot of these adjustments that are being made in the healthcare space, I think are overdue, right? And that were necessary, focusing more on exercise, nutrition, obesity, like those things are all great. I think the problem has become we've taken it so far that now it's defeating the purpose, and you have people literally like confused and almost like paralysis by analysis because they don't know what to do. They're afraid of like, eating like chicken because they're told that, farm raised chicken is going to, cause some sort of disease, right? It's just if you've taken it too far, I think.
Well, I think that there are certain things that there's no data to support it. I'm all for eating pastured chicken and all of that. But interestingly enough, when you actually look at the data for whether pastured chicken is that better for you than industrial, industrial farm chicken, technically there's no science that I know of or any studies that show that the actual chicken meat that you eat from a pasture raised chicken is better for you or has more nutrients than chicken that is actually raised in a big industrial farm, industrial complex. That being said, we whenever we can, we'll buy pastured chicken, we'll buy organic and all of that, because part of it is that I don't want to support the big industrial farms because I know that they don't treat the chickens as well. But technically, is it actually better for you? Not necessarily. Now, there are studies that show that grass-fed beef may be better for you than industrial beef. So it depends on the type of meat. Same thing with when you're looking at wild caught fish. There are actual studies that show that wild caught fish is better for you than a lot of the kind of farm raised stuff. So, but with chicken, there isn't. So unfortunately, I think that people think that there's data out there that there isn't. And I think that once again, social media, and I think people find that, if you put an, a video out there talking about, let's say, GLP-1s, and this is a huge topic in plastic surgery as well. And you have one that's very measured saying, hey, you know what, if you are significantly overweight, you are pre-diabetic, then you should consider going on a GLP-1 agonist like an Ozempic. It will help you lose weight. That's going to help your cardiovascular health and all that type of stuff. Those types of videos aren't going to do as well as a video, let's say, saying that Ozempic will kill you or it's going to shrivel your testicles or something like that. Or on the same side, somebody who's like bragging about how, they only need to lose 5 pounds and they're going on Ozempic. It's like, it's the extremes, unfortunately, that tend to get amplified. And the reasonable voices, unfortunately, in the middle when you talk about social media and media in general that don't tend to, unfortunately, trigger the algorithm to get out there.
Wait, is there people saying that Ozempic can shrink people's testicles?
There is such a thing as Ozempic penis, actually. That is a real thing. But it's actually, I think it's the opposite, is that people find that they look bigger afterwards. And there's reasons why. I think part of it is that if everything around your junk is smaller, your junk proportionally could look bigger. I think that's probably the main reason behind it. But yeah, some people do say that they gain upwards of an inch when they go on Ozempic.
I've never heard that. It's a very but it's funny because like what you just said, I think is the problem, but the benefit of the internet. It's the problem because it's like the clickbait stuff tends to get more views, right? But the benefit is that more people are now, able to access information online that they couldn't, right? And they can learn for themselves and hopefully develop some sense of opinion or values based on, what they want to like kind of interpret and improve their life.
Yeah, but I think you too, Doug, you're an intelligent person who likes to research and develop your opinions very thoughtfully. But there are a lot of people who would, see a meme on the internet and believe it automatically and not question necessarily that there's truth to it. And I think that therein is where it becomes very challenging.
One of the challenges I think people have with their skin is when they start to develop wrinkles or stuff starts to feel a little bit looser, as we talked about earlier. Like, is there any like data that suggests that you can actually like fix wrinkly skin for good, or is it just from like, is there just things you can do like short term?
We will get you back to this episode of the Adversity Advantage in just 1 second, but first, I want to give a quick shout out to today's sponsor, Timeline Nutrition. Some of my main priorities right now are optimizing my health, wellness, and longevity. And as many of you know, I've been a fan of Timeline Nutrition and MitoPure for a really long time, especially these new longevity gummies. And right now, Timeline has a special offer that you can get 20% off your first Timeline purchase. And there's never been a better time to experience the benefits of MitoPure. And if you use my code Doug at checkout, you will receive 20% off today. If you've been thinking about trying Timeline, this is your sign. Once again, they're offering my audience a 20% discount on all first-time purchases. So use code Doug at checkout to get 20% off, or go to timeline.com/Doug to get 20% off. Again, timeline.com/Doug to get 20% off your first purchase of MitoPure and Timeline Nutrition. Now back to the show.
So I think that you have to look at it in one of two ways. If you've got premature wrinkling, premature aging of the skin, can you reverse that without surgery? You can. Can you permanently reverse aging? No, because it doesn't matter like as you get older, things are going to go in one direction, and that is south. Because of gravity, because of the loss of collagen in your skin, you are fighting technically a losing battle in the end. That being said, I see a lot of people who will, let's say, get started on my skincare products. They say, look, I've got all this sun damage. My skin looks terrible. They get on the products. They give it a good 4 to 6 months where they're on the products very consistently, and they see massive changes to their skin. And so they will age in reverse for a period of time. But you get to a point where you can only age and reverse so much. And when you look pretty darn good for your age, you can try to keep that as much as you can, but there's no way to technically continue bringing it back. So if you come in and you haven't taken good care of your skin for many, many years, you've got a lot of sun damage, you got age spots and wrinkles and stuff that are premature, then that can definitely be reversed and doing as little as that 2 minutes, 5 years younger skincare routine. But at some point you may have skin like, let's say, Jennifer Lopez. You look at her skin, you go, wow, she's got beautiful skin. She's in her mid 50s, I believe. Can she reverse aging anymore? No, because she looks about as good as you can at her age. And she's going to continue to age and probably look great for every decade that she ages. But she's never going to be able to get her skin back like where she was 30 again. And so I think that's where being realistic is super important. I do think, and it's hard to say this, but when somebody says you look great for your age is a tough thing to add there because, hey, I'm in my early 50s and people tell me that all the time. But it is truth. You can look great for your age and that's a great thing. But pretty much anytime somebody says you look great, that's kind of what they mean, whether you're in your 20s, 30s, 40s, 50s, 60s, or whatever. So I think that's how I would look at it. Is you can reverse certain types of aging. You don't need surgery to do that. But when you get to that point where your skin looks pretty darn good, things are as tight as they can be at that age, then the next step to really reverse it's going to be invasive procedures. You can start with laser treatments like fractional laser and proceed all the way up to getting, let's say, a facelift.
How does somebody know when they've taken it too far and like enough is enough? You see this a lot where people just get plastic surgery and then it becomes like a thing they just keep doing, keep doing, and keep doing.
So I think that when I look at it as a plastic surgeon, I look at it as, and I turn down about 1 out of every 5 patients that comes to see me, but I look at it as, am I helping them to look quote unquote better, or am I helping them to look different? Now, better is going to be my opinion, okay? And some people may disagree with me, and I may disagree with somebody else that they may decide to do an operation that I would say I wouldn't do. But in general, when I look at a patient, they say, look, I got bags under my eyes, or I've got hanging skin of my neck. I look at it very, objectively of like, if I do this procedure, is that patient going to technically look better? Are we going to improve their appearance? And if the answer is yes, and the benefits outweigh the drawbacks, then it's a reasonable procedure to do. But unfortunately, Doug, there are a lot of people who will come to see me and a lot of people who go see plastic surgeons where they don't necessarily want to look better, quote unquote better. Okay. To them, it may be better, but in general, to the general public may not be better. They just want to look different. They're not happy with how they look, so they want to look different. So they, for example, a good example is this. Let's say somebody who has a nice set of lips. Let's say Scarlett Johansson, beautiful lips. They're nice and full. They look great. And they want lip filler. Now they may want it, but I would say, geez, if you get lip filler, you're not going to look better. You're just going to look different. You're going to look puffy. Okay. And they may think they look better, but if I disagree, then that's a procedure I wouldn't do. Unfortunately, there are a lot of surgeons out there where they will do whatever you basically pay them to do. And they don't turn people down. And one of the ways that I hear surgeons rationalize this, and I've heard plastic surgeons tell me this before, well, if I don't do it, then that doctor down the street will do it. And I'm a much better surgeon than he or she is. So I might as well be the one doing it. And it's like, but then why are you doing the 4th facelift on a 55-year-old? Like, it's still not the right thing to do. Well, if I don't do it, then somebody else is going to do it. They're going to botch it because they're no good. So I might as well just be the one to do it. And I think you're rationalizing doing a procedure that's just not necessary.
Yeah, and I think the interesting thing with this is you talk about better versus different, is that I would imagine, I haven't had plastic surgery, but I would imagine that people who come for plastic surgery, it's because they not only want to feel better about themselves, they want to change the perception maybe of how other people see them in a way, right? Um, and I think what tends to happen if you take it too far is the comments from other people start to become kind of negative because you're like, oh my gosh, like that person, what do they do to themselves, right? It's like language like that. It's just tough. And so, do you ever like outsource or recommend people have a conversation with like a therapist or a mental health professional, like before making some of these decisions?
So, technically, as plastic surgeons, we're psychiatrists with scalpels, is pretty much what we are. I'm fortunate in that my practice, when I see new patients, we schedule about half hour to 45 minutes with each of the new consultations. You compare that to, let's say, a dermatologist who has patients scheduled every 3 to 5 minutes, where they don't have the time, unfortunately, allotted to be able to really go deep with some patients. So for me, and one reason why I have such a long waiting list is because I do spend a lot of time with each new patient to make sure that we get to know each other, that I know what their motivations are, so that we're hopefully on the same page. The problem comes is when you do have a patient where you're not on the same page. We estimate that 1% of the population in the United States has body dysmorphia. And that essentially is a psychiatric condition where what you see in the mirror does not match reality. So their belief was that Michael Jackson had body dysmorphia, and a good percentage of body dysmorphia revolves around the face, specifically even the nose. The nose is the most common area that people have body dysmorphia. And what that would present is somebody who says, look, I've got this huge bump on my nose, I look hideous. And you look at them, you go, wow, I can barely see that bump. There may be one there, but you can barely see it. And so that's kind of what we see with this body dysmorphia. So 1% of the population in general has body dysmorphia. Upwards of 10% of plastic surgery patients have it. And I would estimate that 20 to 30% of nose job patients may have body dysmorphia. And so, but the problem with body dysmorphia, and these are then those patients that will come in, they want something that's unrealistic, their expectations are unrealistic. Sometimes they say, geez, nobody else can do this but you need to save me because I look so hideous. And you want to tell them that, no, you don't, you look fine. But the problem with body dysmorphia is that patients often, and one big feature of body dysmorphia is that patients usually don't have insight. So they don't know they have body dysmorphia. It does not, it's their reality is what they're seeing in the mirror. So it would be as if I told you, Doug, the sky is yellow. And you look up in the sky, you go, no, it's blue. And I go, no, 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 it's yellow. That's the same thing as if you were a body dysmorphia patient and you'd say, I've got a big nose, and the doctor says, no, you don't. It looks fine. You can't understand, like, why can't you see that I've got this massive nose? Because that is your reality. Just like your reality might be that the sky is yellow and not blue. And so it makes it very difficult. So you can try to refer them to a psychiatrist, and I do talk to patients about it sometimes. But the problem with that is that oftentimes they will just phase out, and once you mention that, sometimes they get offended. They can get very angry, and so what I try to do, if I feel that type of discussion is not going to go well, then I try to do the next best thing, which is just try to convince them that maybe they don't need anything done. It's easier. It's an easier lift to say, hey, don't do anything right now. The risks outweigh the benefits. You could look worse if you do it, blah, 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 than to convince them to go make an appointment with a psychiatrist. Most likely you try to do that, they're going to go to the guy down the street, and then, and then he's going to do the operation anyway.
Right. And so I know like one of the things people recommend when they're looking at like getting on like hormone treatment is doing a deep dive on their lifestyle and their health and wellness first before seeing if they need hormone treatment. Like, do you recommend people do that before coming to see you or going to see a plastic surgeon to get some sort of surgery? Like, is it to really assess if there's anything they can do, like to stop the bleeding on their own?
Yeah, I think that's really important. And that's kind of the idea of holistic plastic surgery, is to really start with those things that are non-invasive, and you progress only to surgery if it's absolutely necessary. So I always consider actual plastic surgery as a last resort. So what does that include? That includes obviously changes in diet. That includes skincare. It includes supplements. It includes lifestyle modifications. All those things can really impact your overall health and appearance. But at the same time, I'm also realistic with my patients. Once again, if I have a patient who comes to see me, she said, I've had 4 children, I've got skin hanging from my tummy, it's chafing underneath it, and I don't like how it looks. I can't wear pants very well and stuff. Then I'm not going to say, you know what, but what are you eating for dinner? Are you taking your collagen supplements? Because those are not going to impact that specific issue that she has. At that point, it's like, hey, let's talk about this, about actual, tummy tuck surgery. And what we'll do is we may get them on certain supplements before surgery. All of my patients who have major surgery, put them on a very specific supplement protocol. And that way we can help them to optimize their nutrition prior to having surgery. Certain bad habits we know can really impact the surgical process, things like smoking. And so we 100% have to get them off that. But at the same time, I'm realistic with them that, whether they, are keto or paleo is not going to matter if they want to cut out their excess skin of their tummy. And so it just depends on the situation. Now, if they come in and they say, look, the last 10, I hear this all the time. I feel like in the last 2 years, I've aged 10 years and I've got loose skin and things like that. What's going on, doc? Then, yeah, that does give me the opportunity to kind of get to the bare basics of what we've just mentioned. Because sometimes, once again, lifestyle can really cause our body to age prematurely. Stress is a huge, huge part of that.
And what does stress do to the skin? Like, how does it deteriorate it?
We don't have a direct mechanism of how stress impacts the skin itself, but we do know that it obviously does. And all you have to do is take a look at US presidents, before they enter office and 4 years later, 8 years later, you can see how much stress can really do to the body. But what mechanism is it? Does it somehow cause more further breakdown of collagen? Maybe. Does it increase the amount of free radicals that your body creates from metabolism? Maybe. Is it part of its like lack of sleep? Probably. It's hard to know, and most likely it's probably very multifactorial.
And what are some of the best stress reduction techniques that you found to be helpful for people so that they can protect their skin?
Yeah, I think the first thing that I recommend, obviously, is going to be therapy. And so if you have a lot of stress, I always encourage you to seek therapy. It used to be like, oh, I don't want to go out of my way to go, find a therapist and this and that. Now that telemedicine is so easy and popular, you may have heard, and I've done brand deals with them before, but this is not sponsored or anything. But BetterHelp is a easy one that you can sign up on and get a therapist and get assigned to somebody very quickly and not have to leave the comfort of your home. So I think that therapy is a great option for just about everybody. I think everybody basically can benefit from therapy. I've done a little bit in the past. A lot of my family members have done a lot more than I have. At some point, I'm probably going to really want it, but I do think therapy is super helpful for people. Another thing that you can do directly that can impact your stress, and that can definitely leave an impact on your skin, is meditation. I'm a big fan of meditation. I don't meditate as much as I probably should, but last few years I've been doing much more than I have in the past. Meditation is very easy because even if you just meditate for 10 minutes, there's a lot of guided meditations out there. I don't know if are you a Peloton guy?
I used to ride the Peloton, but I don't anymore.
Yeah, so I'm still a Peloton guy. I don't ride it as much, but I do a lot of their yoga and I do a lot of their meditation because it's just so easy. And I do find that just 10 minutes a day, or at the end of the day, or even sometimes first thing in the morning, I'll meditate for 10 minutes, can really put your mind in a very different place and can really impact how you deal with stress and the stress that you're feeling. So doing a guided meditation like that, I think, is great. If you don't want to do a guided meditation or you don't have access to that, then a very simple way to meditate is you take your mobile phone, you set the timer to 10 minutes, you sit in a quiet room, sit cross-legged, close your eyes, and then just pay attention to your breathing. That's all I have to do. Just pay attention to your breathing, in and out for 10 minutes. Your mind is going to wander. Things will come into your mind of like, oh, I got to go do this. I got to do that. Every time it happens, try to bring you back just to the breathing. And you're not a failure if that's hard. It's hard for me too. But the idea is to quiet your mind and just to kind of let all the other stuff go and letting your mind just relax for that 10 minutes can be really, really huge. And that's a very simple way to do a very simple meditation. Some people, instead of just paying attention to the breathing, will also, let's say, repeat a mantra. So if you're real stressed, you can repeat a mantra of like calm, 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 that type of thing. And sometimes that can really, really help people.
So we talked about stress. We talked about like a little bit, as far as the diet and how it impacts skin. I mean, has your perspective on what to eat changed since we last spoke, or is it still like eat whole foods, limit ultra processed foods if you're trying to maximize your skin health?
Yeah, one thing that's been very interesting since we last spoke is there's been a lot of focus on protein and muscle since we last talked about. And it's really interesting. There are some people, some docs who are really paving the way for it. And especially, it's especially geared towards women and women who are in peri and postmenopause, finding that sarcopenia or muscle breakdown is a major, major issue. And so, what we are learning is that, and really with the skin, that's a big thing as well, is that the amount of protein that we eat in general is less than what we probably need. When you look at it, okay, as you get older, the one of the number one things you want to avoid is breaking your hip. There's a 1 in 3 chance of death in the first year after breaking a hip if you're over the age of 50. And I'm over the age of 50, which means that if I break my hip, I have a 1 in 3 chance of dying technically within a year. And that is crazy. And so one of the big things you want to do is avoid breaking that hip. And how do you do that? Well, a lot of it has to do with muscle strength, with fast twitch muscle fibers. These are very important to stabilize your body, and trying to prevent that sarcopenia, that muscle breakdown. And so there really has been a very interesting focus on increasing the amount of protein that you eat, especially if you are postmenopausal, because a lot of women have not been getting that. The amount of protein that is recommended by a lot of doctors now, especially once again, postmenopausal women, is about 1 gram per day per pound of ideal body weight. And so that means if your ideal weight for you is, let's say, 120 pounds, then you're looking at 120 grams a day. Now, you may weigh 140 pounds, okay, but 120, if that's kind of where you feel you're best at, then that's the weight that you should be looking at. And when you look at skin, this is really important because collagen is a protein. And if you're not getting enough protein in your diet, then you're not going to get enough protein to help prevent collagen breakdown. And that's going to cause you to age prematurely. And so that's something I think that's really important for people to realize, is that protein is so important. Collagen is a very, very popular supplement nowadays. It's our number one selling supplement, is our supplemental collagen. And with good reason, because we do know that collagen breakdown occurs about 1% a year, starting in our mid 20s. Women, though, when they go through menopause, in the first 5 years after menopause, they lose something like 30% of the collagen of their skin in just a few years. It's crazy. And then they lose about 2% a year after that. And so for a woman who's, let's say, perimenopausal, postmenopausal, really making sure you're getting enough protein, doing a lot of strength training, resistance training, working with weights, as well as resistance machines, and then also taking a daily hydrolyzed collagen supplement. Those are 3 things I would strongly, strongly encourage.
Yeah, protein is so important in building muscle, and I think it's just really important for your overall mental health and framework for how you see the world. Like, I think if you're working out and you're consistent with that, I think it will enhance like how you feel about yourself, throughout the course of the day and then throughout the course of the week. Um, we talked a little bit about like overreaching as far as data and stuff. Is there any like big myths you've seen in the last like 6 months that you've either busted on your own YouTube channel or that you want to like kind of um, dispel right now?
I think there's a right now in plastic surgery, there's this big thing going on with all these young people getting facelifts done. And I was actually on a prominent podcast they recorded the other day, talking, and they asked me, "Hey, can you look at some of these celebrities?" And the host, beautiful host, really nice person, was saying, I think that all these celebrities, these young celebrities in their 20s and 30s, have had big facelifts done, and I don't think that's the case in all of them. I think, yeah, some of them, but not all. Um, the facelifts right now are all over the media. Chris Jenner had a facelift done by a plastic surgeon in New York City. We've seen Lindsay Lohan, who's had this fantastic glow up. She looks fantastic. We have seen Christina Aguilera, who looks great. And I think that people are saying everybody has had a facelift, and they're all saying everybody's had what's called a deep plane facelift, which is a type of facelift that's pretty aggressive. And I think the truth is that we think celebrities are getting more done than they really are, and I think makeup and filters and all that really play a huge part of it. So we do know Kris Jenner had a facelift. She looks fantastic. I think she's very early after the facelift, in which case I do think it's going to change as time goes on. But I don't think that, for example, Emma Stone had a facelift. That doesn't make sense to me. I think that most likely she just looks great because she takes care of herself. Lindsay Lohan, on the other hand, maybe we'll see. She hasn't admitted to it though. So I think the whole thing is like everybody's having a deep plane facelift. I think is BS. In our field right now, deep plane facelift is a hot topic, and everybody's saying, "Oh, Kris Jenner, when she came out, she had a deep plane facelift." She didn't. She had a mass facelift, which is something more similar to what I do, which is a bit less invasive, quicker recovery.
Talk about like how intense people should be about taking care of their skin based on their age. Like I know we've talked about people like being intense, like when they're young about their like too intense about it when they're younger. Like, so talk about the trajectory there.
So you want to increase the intensity as you get older, and so unfortunately, there are teens and preteens who are going to Sephora, buying all these skincare products, thinking that they need it for their skin, and that is just not true. If you are young, if you're in your teens, really what you need to do is use a nice cleanser, use a sunscreen if you're going to be out, and then if you want to add a moisturizer, feel free. And that is really it. You know, if the moisturizer has some vitamin C in it, that's great. If you've got issues with some acne, you want to use a retinol, by all means, go ahead and do that. But if you've got perfect skin and you're 12 years old, you don't need to use retinol. Vitamin C, fine. That doesn't do anything, other than protect your skin, which there's nothing wrong with that. But unfortunately, when you're using a lot of the actives, people use a lot of alpha hydroxy acids and stuff like that, and you're a preteen, it just doesn't make sense. Every decade that you go through, you do want to add something more to it. And actually, we created at Youn Beauty, my skincare company, we do have what we have is called, the first one is a Gen Z bundle. Then we have a bundle of, and that's a very basic bundle of products. Then we've got a millennial bundle, which adds a little bit more to it. We've got the Gen X bundle, which adds definitely more to it. And then we've got the baby boomer bundle, which is pretty much the works. But we don't have a Gen Alpha bundle because their bundle shouldn't be anything other than just a good cleanser and a sunscreen. And so I think it's important, the first things you want to add is going to be, like I said, like a vitamin C, because you're going to help protect your skin. Add that retinol when you get definitely by the time you get into your 30s, you want to add a retinol. If you're in your 40s and 50s, I encourage you to add a second anti-aging cream, ideally one containing peptides, growth factors, or bakuchiol. I think that's great. And then once you're in your 50s, 60s, 70s, then essentially what you want to do is look at the works. Whatever you can afford to apply and what you have time to. There's some people who are open to a 6-7 step skincare routine. Other people just want to do 1 or 2 and be done with it. So do what works for you, but in general, that intensity should be increased. And that's why we create these specific bundles, actually.
What do you recommend like people do on a daily basis, like morning and evening, if you're like in your 30s, like if you're a guy or a girl in your 30s, like what is the basic thing people should do to biggest bang for the buck?
Yeah, so that's going to be the 2 minutes, 5 years younger skincare routine. That was what we started the podcast with. And so we're kind of coming full circle now. So it's going to be cleansing your skin in the morning with a cleanser appropriate for your skin type, using a good vitamin C serum afterwards. That's going to protect your skin and it's going to help support collagen production, reduce the degradation of collagen. And then once again, that sunscreen, if you're going to be out, make sure it's SPF 30. And once again, if you're going to be in a basement all day, you're going to be inside all day, you don't want to wear sunscreen. I don't wear sunscreen every day. I admit it. I'm not a dermatologist, so I'm a plastic surgeon. But that once again, up to your discretion. At night, you want to cleanse your skin. If you only cleanse your skin once a day, definitely do it at night. You got to get rid of the day's worth of dirt, grime, pollution, oil, all that type of stuff. And then I do recommend a retinol. So once again, starting in your 30s, a retinol, it's a great time to start a retinol is when you're late 20s, early 30s, because that's going to really help to slow down that aging process and keep your skin turning over more quickly. And even can reverse some early solar damage and sun damage. And then the final thing is you want to exfoliate your skin once or twice a week, depending on how sensitive your skin is. You can do that with a gentle scrub, or you can use like an alpha hydroxy acid type of a chemical exfoliator. And that's really the basic thing, somebody in their 30s. When you get into your 40s, you want to add, once again, probably another step to that. You probably do want to add at least like a retinol eye cream. So start, treating the eyes because they'll start, getting a little bit crepey, definitely starting your 40s. And then you also want to maybe consider, at least by the time you hit your 50s, adding a second, once again, anti-aging cream to that.
Consumer Reports just came out with like a list of like protein powders that contained like lead and certain amount of chemicals and stuff. I'd love to, like, as we're wrapping up here, touch on your perspective as that relates to like skincare stuff and why your products are different, like kind of what people should look out for when they're buying supplements or skincare products.
Yeah, I think it's really important to try to go with as clean of a product as possible. When I first started my practice, I went for years. This is before I really knew about natural products. They weren't really focused on that much back then. I went for years not doing anything other than washing my face and putting a very gentle moisturizer on it because anything that I would put on my skin would cause it to break out in hives. Now, that being said, I sold skincare products out of my office, medical grade products made by dermatologists and stuff like that. And patients did great with it, but I couldn't tolerate it. And that's why I started my skincare line. I actually, discovered natural skincare products and I started applying them to my face. And I was shocked that I didn't react to them. But the problem with the natural products is that the ones that at least the ones that I tested had nothing active in it to actually reverse aging or to slow the aging process down. They're basically just nice moisturizers. And so for me, I thought, well, why can't we have both? Why can't we have skincare products that are made with natural and organic ingredients? They don't have the added fragrances. They don't have all the additive preservatives that can cause irritation of your skin. But they also have those active ingredients. They have the vitamin C, they have the retinol, they have the bakuchiol and the peptides and all of that. Why not have a skincare line that combines both of that, both goods into one? And that's why we came up with Youn Beauty. And I've been really proud of it. Once again, they're made with natural and organic ingredients. There's fragrance free. They're cruelty free. I think just the same as people are very picky with what they put in their mouth. You do want to be picky with what you put on your skin as well. And you may find that your skin's going to tolerate long-term products that are cleaner than products that you may buy at the drugstore that have, a bunch of added ingredients that are absolutely unnecessary.
And can you go into a couple specific ingredients before we wrap that could damage the skin that people should pay attention to?
Yeah. So the first one you want to think about is just added fragrances. Fragrances, whether, some people say, oh, well, essential oils are fine. Actually, not necessarily. Essential oils may be, for your health fine, but they can still be very irritating to the skin. So the first thing are added fragrances. There is a belief that some fragrances could be hormone disruptors. The problem with fragrance is that the manufacturers don't have to release what that fragrance is made out of. They just put fragrance on it. And so it becomes kind of a big question mark of what it is. So that's going to be the first thing. And then another thing that could be potentially harmful to your skin are formaldehyde releasers. There are certain products that may have preservation ingredients in it that if you leave it on for too long could potentially transform into actually formaldehyde type byproducts. And so that's something to avoid as well. A final category of products that I would encourage you to maybe rethink a little bit. There's certain chemical sunscreens, oxybenzone and octinoxate, that may be potential hormone disruptors. If you're going to be out in the sun and you either put an oxybenzone sunscreen or nothing, go with the oxybenzone. But if you have the option between oxybenzone and a zinc oxide, or oxybenzone and an avobenzone, then go with the zinc oxide, go with the avobenzone because they have not been shown to be potential hormone disruptors. So that would be another group that I would be careful with.
Well, Dr. Youn, this has been awesome. Thanks again for returning for your third time on the show.
Thank you.
If people want to find out more about your stuff, where do they go?
So my skincare line is Youn Beauty. So then go to younbeauty.com. And I have my own podcast, which I'd love to have you on. It's called The Dr. Youn Show. It's available wherever podcasts, wherever you get your podcast, wherever you get this podcast, you'll probably find The Dr. Youn Show somewhere around there as well.
Awesome. Well, I'm definitely looking forward to coming on your podcast. So thanks again for coming back on the show. Always love catching up with you.
Hey, thanks, Doug. We'll talk soon.